Hi, good afternoon. Welcome to Inside the Index, Global Health 50/50's webinar series, where we're talking about our research and our methods and hoping to engage with more people around our work. So with that in mind, let me introduce myself. My name is Alex Parker, and I am the Communications and Advocacy Manager at Global Health 50/50. We would love it if you could let us know in the chat your name and the organization and country that you're joining us from. We'd love to get to know who's in the room. So today we're going to be hearing from Global Health 50/50's Deputy Director, Sonia Tanaka. Sonia has been with GH 50/50 since its inception, and so she's well placed to take us through some of the changes to the Gender and Health Index in 2023. Sonia will take us through these changes and additions, after which we'll have some time to answer any questions. So please feel free to pop any questions or comments you have in the Q&A function or the chat box. So over to you, Sonia.
Great. Well, thanks, Alex, and hi, everyone. Really delighted that you've been able to join us today. I'm going to take us through a set of slides. Let me get those opened up. Oops. Voila. So as Alex mentioned, I'm going to be taking us through a brief introduction to our report. I assume that the people joining are fairly familiar with what we do each year, but then really focusing on what is new, and then a bit of time at the end on the timeline for the completion and production of the report. So just a quick recap, we are preparing our 6th annual report this year. We again are looking at the gender-related policies and policies, practices, programs, and some outcomes across 200 organizations that are active in the global health space. We, and as you can see here, each year we maintain 7 core variables, and that allows us, we try to keep those as consistent as possible each year, because that allows us then to compare progress across years. We know that's important for tracking organizational progress. We also add a special theme and to allow us to dig a little bit deeper on one aspect of the framework. And I'll take you through what we've selected for this year. We've also been expanding the framework kind of year on year. In 2020, for example, we added a range of variables that looked beyond gender diversity and tried to incorporate other aspects of diversity in the workplace. And we've integrated those into our kind of core variables year on year. Moving forward, we keep in mind as we're expanding, evolving, adding to the framework each year, that primarily we want to ensure that what we're doing is relevant to organizations. We know that this is a space that is evolving quickly, priorities, kind of best practice and evidence around what works. The discourse is changing. And so each year we're updating the framework to respond to that, those kinds of developments, to ensure that it's as relevant as possible to organizations. And then we want to ensure that it's reflective of best practices. And so we are constantly kind of critically assessing the criteria that we use when we assess organizational performance against our variables. We've established a methodological approach that's very much based in systematic research methods. We draw the variable framework as well as the criteria that we use from the kind of global normative guidelines, gold standards. A lot of that comes from WHO or from the International Labour Organization. We've got 2 reviewers who look at organizations' websites, and they're extracting data primarily from websites, but additionally from internal policies when those are made available to us. 3rd reviewer goes through that data, and they kind of, as a group, will discuss discrepancies until they reach a consensus. And then those findings are scored against the key that GH5050 has developed. After that initial round of data collection, we go into a validation phase, and that's where we work closely with organizations, that really, to the extent that organizations would like, and the extent to which they engage with us, over a period of about 6 weeks, assessing the data, giving organizations an opportunity to supplement, to challenge, to amend, until we can kind of reach a shared understanding based on available evidence as to how an organization is performing on each of these variables. We, as I said, our data comes primarily from publicly available websites, and that's a decision we've made that's really rooted in our emphasis on transparency, which we consider to be an essential aspect of accountability. Transparency allows public scrutiny, including from independent organizations like ourselves. It also allows access, insights for people who are considering joining an organization, for example, and are curious in exploring what they can expect in terms of organizational support to their career opportunities, and whether they can expect that they will be supported kind of in equal and fair ways as other people in the organization. We don't collect confidential information. We don't report individual data, and that is except for the gender and nationality of the CEO and board chair, although that's data that's we find only in the public domain. And we have submitted our methods over a number of years when we were housed at University College London to the ethics committee there, and so these methods have been approved a number of times over the years. So our research framework, we've got 1, 2, 3, and 4 here, and these, if you're familiar with the report, will look very familiar. These are our core variables. We kind of distinguish them in 4 buckets or domains. 1 being commitments to redistribute power, to gender equality, and whether an organization defines gender. 2 is where we look at workplace policies. We look at gender equality policies, D&I policies, and board diversity and inclusion policies. And that's where we're really diving in deeper this year. We'll be returning to a larger set of workplace policies this year, as we do every 2 years. And that includes sexual harassment policy, parental leave, support to new parents, the flexible working, and gender pay gap. And then we're also expanding it in another direction, and that's digging a bit deeper into primarily around the diversity and inclusion aspect of the framework. And I'll get into this a little bit more in the next slide, but what we're exploring here are what we find in terms of how organizations are defining EDI, what that means to the organization, and thus what their goals and ambitions are. We're looking for the presence of affinity groups or employee resource groups, for example. They're called a host of different terms, but really whether there's an opportunity for staff to come together in a space that enhances belonging, that enhances sense of inclusion, that it also becomes a space for kind of collective action in trying to influence the policy environment in the organization. And 3, does an organization conduct staff surveys? So is there some kind of a channel that allows for some anonymous feedback from staff to leadership? And is any of that, the results of those surveys, published? Then just moving on to 3 and 4, as we do each year, we'll be looking at the gender parity in senior management and governing bodies, the gender, nationality, and education of the heads of the organization and the board chairs. And then our 4th dimension, which is much more around whether an organization incorporates a gender lens into the work that they deliver kind of out into the world, as opposed to the policies that they have in place to promote gender equality in the workplace. So we're looking again to see whether there's a policy that an organization has in place to ensure that that data is sex disaggregated, kind of as when we're relevant and meaningful. What we aren't doing for this report, kind of this July annual report, is looking at the gender responsiveness of organizational approaches. And that is because we are preparing a separate report for the fall that will focus really primarily on that variable, with a thematic focus on planetary health and gender. So we're going to be exploring the extent to which organizations are incorporating a gender lens into the work that they're doing on planetary health. So why we've added those kind of new variables on diversity and inclusion in the workplace. We've been working over the last year and a half or so with an organization called Gender at Work, and they are a kind of an expert consulting group that focuses on the promotion of gender equality in the workplace. And we had 2 kind of key challenges that we put to them. One was, what can you learn from the organizations with whom we work, we assess, about their the level of kind of relevance, uptake, and impact of the GH5050 report and index. In a kind of mini independent evaluation, we wanted to know how organizations are receiving the data that we're putting out, whether they think it's making a difference, what could be improved in terms of the work that we do, and how we support organizations with this evidence on their journeys, kind of their D&I journeys. The second question that we posed was what they could glean both from a desk research, as well as, again, engagement with organizations, as to the opportunities to incorporate any kind of proxy measures that could provide us some insights into organizational culture. We're very aware at GH5050 that as an independent organization and a very small, with very limited capacity initiative, that the limitations that we confront are that we very much rely on assessing words on paper. So we can gain access to policies and strategies. We gain access to how organizations talk about themselves in public spaces. But what we can't gain access to is any qualitative data around perceptions and experiences inside of a workplace, the implementation and enforcement of policies, and whether there's any kind of accountability in terms of policies being implemented or not. So this report, you see on the left, Inform, Inspire, and Incite Actions to Promote Gender Diversity and Inclusion, is on our website. And if it's a topic of interest, I encourage you to go explore it. It provides, so the findings from the desk research around what is organizational culture, what are the kind of ongoing efforts to shift organizational culture, and what are some of the proven mechanisms that organizations have tried and tested to promote inclusion, belonging, as well as diversity in the workplace. What Gender at Work also did was interview a number of organizations in our sample to understand what global health organizations are doing on this issue. And I mean, one big takeaway is that there's a huge amount of work, I'm sure, as you're all aware, on behalf of organizations attempting to understand their culture and identify areas where there seems to be a need for culture change. What came out of the study was a couple of recommendations for us in terms of what kind of proxy measures we might be able to include that would allow us still as an independent organization to collect and have access to this particular data. And so that's where we came up with the variables that we have added are in direct response to the recommendations that arose from that research, including tracking the presence of employee resource groups and staff surveys, as well as management response to those staff surveys. So this, just a little bit kind of in further detail, I guess we are not going to be scoring organizations based on whether we find definitions of EDI. What we're doing at this stage, primarily because there's not really global normative guidelines around what EDI means. It's very, as we all know, extremely context specific, and thus there's not really a standard for us to score against. What we will do is share kind of a lot of the definitions that we are finding as a resource to organizations who might be interested in how their peers are approaching this issue. So the other aspect where we're expanding the framework is that we're adding a real focus on reproductive justice to the framework, in addition to the policies that we're collecting there every 2 years. Why are we doing this? We, as with the rest of the world, have been witnessing the rollback of reproductive health and rights in a number of countries, and as well as some interesting examples of where the private sector, where the employer is trying to step in to fill the space of where there normally might be national or kind of federal policy that would protect the reproductive health and rights of people. And so we were interested to explore, kind of even in the absence of national policy on reproductive justice related issues, are employers trying to fill that gap and respond to the reproductive health and rights needs of their workforce. So we're taking a bit of a kind of a career course, life course approach to this variable, recognizing that reproductive health and rights, reproductive health needs and rights change over the course of one's career/life, and that starts with a recruitment policy. You know, is there policy around the lack of discrimination or zero tolerance for discrimination of women, pregnant women, of women of reproductive age, or of people based on their family plans. There's also a couple of policies that we're going to look at around reproductive health beyond the intention of becoming a parent. That includes support and/or time off related to menstruation. We will be looking at looking for kind of a number of policies around support provided to people who are trying to become a parent or are becoming a parent. And then what policies are in place to facilitate a return to work after a child, a family or a parent has had a child. And then kind of following, even after immediate return to work, then the number of years that where staff may need support meeting their caring responsibilities, whether for children or from other family members, or and thus whether there are any policies that are in place to support people to meet those caring responsibilities. And then finally, a couple of policy interests around the later career reproductive justice issues. So in much more detail, those policies are laid out here. And when I say policy, what we're really looking for, kind of the minimum that we're expecting to find, and recognizing that most organizations, we've done a kind of scoping exercise so far. Most organizations don't have this kind of detailed policy in the public domain. So we will certainly be inviting organizations to share internal policies with us. What we understand to be kind of the most common policy around these issues are references to these needs in a leave policy. So does an organization provide kind of paid time off of work for any of these life events? And then over here, I mean, immediate return to work, that's one that we already track. The flexible working for kind of new parents, whether there are facilities in a workplace for people to breastfeed, whether there's childcare facilities. And then through basically kind of through towards later stages of a career, are policies and strategies that provide time off or other kind of support services for people experiencing menopause. And then are there any kind of flexible working arrangements that are available to staff as they're working towards retirement? So that's the framework that we're collecting data on, and we'll put these slides in on our website if anybody wants to return to them at a later point or share them with colleagues. In terms of our timeline, working backwards from a mid-July work where we are launching our report, we're going to be launching at the Women Deliver Conference in Kigali sometime between the 17th and the 20th. Then we are planning to, as always, kind of share the embargoed report in a communications package with organizations about 10 days prior to launch. And over the months of May and June, that's when we are analyzing data and we're drafting the report. And thus, so we're planning to send the data that we're collecting currently and validating internally to organizations in the next, fingers crossed, kind of 10 days or so. And once organizations receive that data, we plan to do 2 rounds of validation over the course of about 6 weeks. And when I say 2 rounds of validation, that means that we will share the data with organizations in the first round for about 3 to 4 weeks, receive edits, amendments, additional information, questions, queries, respond to all of that, integrate any new information into our findings, and share it again a second time with organizations so they can verify our interpretation of organizations' feedback. And then before we close the data set, sometime around the very end of April. And I'll stop there. Really happy to take any questions that may have popped up. Thank you.
Thanks so much, Sonia. And that was, I think, really helpful to understand what's new in 2023 and what to expect going forward until July. So thank you very much. Just an invitation to everyone who has joined us. It's quite a small group, so please feel free to pop your question or comment in the chat or raise your hand, and I can unmute you and we can have a conversation. We do have one question from Catherine. She asks for thematic reproductive justice. Will this only be measured this year or continuously in following year reports to inform as organizations start to dig into this and gain more resources?
Yeah, good. It's a great question. And one I can't answer right now. I think we would hope to incorporate, I think in the way that we return to the extended set of workplace policies that we look at every 2 years, I could see us incorporating this additional package of reproductive justice policies into that kind of biannual review. But we haven't really gotten that far in our planning. So, but a good reminder to raise that with the team internally. Thank you. I see. Yeah, Elizabeth's got a question.
Yes. So Elizabeth says, are you interested only in information we have on our website or other information? For instance, we do not report the staff survey findings, but we do 2 surveys annually.
Yeah, no problem, Elizabeth. We are going to be inviting internal policies, evidence, once we share the data with organizations. And so there will be an aspect, we're kind of trialing an aspect of self-reporting this year, and specifically with that staff survey in mind, recognizing that it's unlikely that organizations are going to have information on their staff survey, and especially not in most cases won't have a management response or to staff survey findings. So we will certainly be inviting internal information to complement what we find online.
Thanks, Sonia. I think Sylvia, that question was quite similar. Also commenting on the fact that staff surveys are not expected to be published on websites, but rather on intranet platforms. So I think,
yeah,
I think we've answered that, Sylvia. Are there any other questions or comments? It's one from Casey. Do you have recommendations for how to report or describe reproductive health benefits and policies that differ across office locations globally?
Well, I mean, just in terms of what we look at GH 50/50, and it's primarily in recognition of the complication of and kind of the complexity of global organizations, and kind of by their nature may have quite different policy environments for their staff based on the country in which the office is located. So we only look at kind of HQ or global level policies, and so that would be the kind of documentation that we would be collecting for this. But I can see that being a really an interesting exercise to gather for an organization itself, you know, to do kind of comparison of the different policies that are available to staff by office. But it's not something that we'll be looking at anytime soon. Although, I mean, you know, I can imagine that would be really fascinating to do if we had some more capacity in the coming years.
Great, thanks, Sonia. And Elizabeth has just commented on thanking us for what we do. And yeah, that's great to hear.
Well, yes, it is. Thank you. Yeah, and thank you. You know, the work that Gender at Work did was really enriched by their conversations with a number of representatives from the organizations that are in the sample, and so we're just incredibly grateful that that your organizations continue to engage with us, and we're always striving to make the tool as useful and effective and helpful as possible. So thanks for engaging with us.
Catherine has another question for us. She asks, you mentioned in the fall there will be a new report for gender responsiveness of organizational approaches. I love this idea. Will it be a similar data collection analysis process as the current report? Will there be detailed guidance to organizations on what will be included in this so that we can prepare and possibly use that to enact some initiatives before that time?
Yeah, so I mean, what we know about the fall report, and thanks for your question. It's one that we're really excited about too. So we're going to be looking specifically at the work that organizations are doing on the issue of planetary health. We've kind of recognized that there seems to be a dearth in both the kind of the academic and the policy work, as well as the programmatic work in integrating the gender and broader equity lens into a lot of the planetary health activities that are being conducted by global health organizations. And what we don't know yet is whether we should be publishing that data by organizations. And I'll tell you one reason, and I mean, it'd be interesting to hear your feedback. One reason for that is that we don't want to overburden organizations by sending around another validation request, because we'll be starting to do another round of data collection, looking at organizations' websites and their strategies, what they're doing on planetary health. But for us to kind of ethically to report anything publicly by organization, if we're kind of scoring an organization's performance, we need to verify, at least give organizations an opportunity to respond to that data before we publish it. So we were, I think, coalescing around the idea that we would not be publishing those findings by organization, but rather using that report in the first instance, kind of this year in advance of next year, but as an opportunity to get a sense of what's happening across the sector and reporting on those results in an aggregate way, before then potentially breaking that back down into individual level results the following year.
Thanks, Sonia. That's really interesting to consider, and I'd like to invite anyone who's here with if they'd like to comment or respond to those considerations. It's really fantastic to have so many organizations represented today in this webinar. We are really aiming to make our report and our data and methods a lot more accessible. So it's really great to have you here with us and have an opportunity to share more detail. Casey asks, is there more information on the full report topics that we can bring back to our organizations?
Yeah, Casey, if you give us a couple of weeks, it's a really welcome prompt for us to put out something, a kind of a concept note to how we're proposing to bring that report together. And we will we can make a note of trying to get that done over the next couple of weeks and share it with you and with others.
And just to say, Sonia, that Catherine sounds really positive about the way forward for the full report.
Wonderful. Well, thank you so much, everyone.
Yes, thank you very much, everyone. So we'll be putting this webinar recording up on our YouTube channel as soon as we close today, and we'll be continuing this webinar series later in the year, following the launch of the report in July, and hopefully we'll as we have more detail with the full report, we'll also have something on that closer to the time. So just to say thanks very much to Sonia for sharing this information with us and making it easily accessible, and thanks to everyone for joining us. It was really great to have you join us today, and until later in the year, take care.